All right. Welcome to the OuchCast. This is the podcast where we talk about the various topics in pain and as they relate to medicine. My name's Neal Rakesh, and I'm joined with my host today, Dr. Jonathan Ramin. How's it going, man?
Hey, how are you, Neil? What's going on?
Nothing much. Now, I know we've had a few topics that we want to talk about, but today we're focusing on physical therapy, right?
That's right. Yeah, I had a patient the other day I was about to do a procedure on, and one of the things they told me before we started the procedure is that the doctor that sent them to me said that physical therapy is no good for them, that they wouldn't benefit from any physical therapy. And my thought was, and I kind of told the patient this, that really you definitely would benefit from physical therapy. The reality is almost anyone would benefit from some physical therapy. And so I thought that it was an important topic for us to discuss because I think the patient population needs to be aware of the fact that physical therapy is a really important part of um, getting treatment for certain musculoskeletal conditions or really virtually all
Yeah.
staying healthy.
Yeah, it's interesting. I actually hear that a lot. I was talking to someone last week, and it was the fact that they were talking to some other doctors, and it was that they don't believe in physical therapy at all. So none of their patients get physical therapy, and it's just kind of procedures and what have you. And I feel like maybe I'm the other end of the spectrum. I'm physical therapy for everyone because I feel like there is something that's always going on that has a biomechanical issue or something that's maladaptive. And so I think it's going to be interesting to kind of learn a little bit more about it. Can you tell us who's the guest you got for us today?
Yeah, so we invited Dr. Ryan Waldman. He's a doctor of physical therapy in Manhattan and the New York City area. Just I'll let him kind of introduce himself and tell us a little bit about himself, and then let's get into some discussions.
All right. Hi, everyone. Thanks, Dr. Ramin and Neal, for having me today. So a little bit about myself. I'm a physical therapist. I've been in practice for 7 years. I've worked in hospitals, in academics, and in private practice. So I've kind of done it all. And I'm really happy to be here and talk a little bit about physical therapy and support our profession.
So let's start with the simple thing. I think that what exactly is physical therapy? If you had to classify it or justify why is it called physical therapy?
Well, first off, physical therapy is definitely not personal training, right? So that's the first thing. Sometimes when people say PT,
They're
they think of
the
us
same letters.
as personal trainers. So I kind of just jotted down here what the definition is from the American Physical Therapy Association of what physical therapy is, and then I'll kind of explain more. So physical therapists are movement experts who help improve quality of life through personalized exercise, hands-on care, and patient education. So the big thing that kind of differentiates us from, other healthcare, professionals like chiropractors or personal trainers is that we are really trained in movement and how to analyze movement, how to correct movement, whether that be something like sitting to standing from a chair or, squatting, deadlifting, running. We're really there to help people move better. And, not only are we important in when people are experiencing some sort of injury, but also to help prevent injuries, which is called prehab. And that's just as important, you know, as treating people when they're injured is teaching them and educating them how to not get injured.
I like that, and there's a lot of things you just delved into there. Obviously, I mean, the definition encapsulates a lot of things, but I feel like we're gonna dissect this a little bit more. Let's start with the easiest thing. Is obviously we know we're not personal trainers now. That's let's get off the ground with just that. What's the difference between PT, OT, and chiropractors? Are they all the same thing?
They're definitely not the same thing. one thing I wanted to kind of just backtrack on, physical therapists, we go through 7 years of school, 4 years undergrad, and then 3 years of a doctorate level program. So we do have 7 years of schooling. In our 3 years of PT school, we're out doing, anywhere from 34 to 40 weeks of clinical and hands-on experience. So, all people coming out of school, in the last, 10, 15 years, all have their doctorate in physical therapy. So just
That's
wanted to throw
wild.
that out there.
That's wild to
It's
me. Like,
changed. It's
I
changed
feel
quite a
like
lot. It used to be a bachelor's degree, and now, we are doctors. So
yeah, it's interesting. Both my parents are PhDs, and I grew up with them. It's everyone would call them doctors, and so I never knew a distinction between there is like someone's like, "Oh, you're a real doctor." I was like, "What does that mean?" Because my parents were always called doctors. They were doctors of science and engineering, and I know I was talking to John earlier about this, and it's what is is there? Do you call any therapist a doctor? Is that the convention? And it sounds like it's like PhDs. It's the same thing. If you go through a doctorate, it's Doctor So and So.
yeah, I mean,
Does that make sense?
I totally agree for sure. Um, so what the difference is between PT, OT, and chiropractor? So let's start between PT and OT. I once heard kind of a good, definition that kind of put it into lamest terms, where OT might help you with things at point A and point B, whereas physical therapists help you get from point A to point B. So, occupational therapists might help with functional activities, using the bathroom, and kind of helping, with adaptive equipment, and teaching you kind of how to do more ADLs, which is activities of daily living. And physical therapists, like I explained earlier, are helping more on, movement, and, working more on, trying to help you get from point A to point B, if that makes sense in lamest terms.
So as far as chiropractors go, and I think that there's definitely a role for all of you guys when it comes to treating patients. But I definitely hear a lot of patients come to me and ask specifically because they don't necessarily always know about the occupational therapy, but the chiropractor and the physical therapy, even insurances sometimes will accept one versus the other as forms of treatment prior to any type of intervention. So that's why I'm kind of curious also what your thoughts are and what's the difference between the two.
Yeah, this is a question that, is debated a lot of places. Should you see a physical therapist for back pain? Should you see a chiropractor? Some people swear by chiropractors and don't want to do physical therapy, and vice versa. I think they both are important in certain ways. Chiropractors don't go through the same type of schooling as we do, right? They go through schooling that focuses mostly on the spine. And so they are also not movement experts. Their function is to diagnose and treat spinal issues. And I think in today's world, chiropractors, just treat kind of everything. They treat foot and ankle issues, hip problems. So they are treating a lot more these days. So I don't know, how their governing body, regulates what they can and can't treat. But the biggest thing is that, physical therapists are going to do a lot more, hands-on and manual type of work. Again, look more at the movement aspect, how you're moving. And chiropractors are going to focus mostly on adjustments, maybe some stretching. So the big difference is one is focused mostly on, just looking at the spine in and of itself. And then a physical therapist might look a little bit more kind of at the whole picture, and see if one thing is related to the other. But of course,
That's
that definition or that comparison can be argued, by chiropractors, what they do. So,
Yeah, I
that's
think
kind
I
of
think
just
that will be a
a brief
conversation. Yeah,
explanation.
I
Yeah.
feel like we're about to start a
I think we'll have to
war.
bring. I know. Yeah, I think we'll have to bring a chiropractor on at some point. Maybe we'll bring you back. Ryan,
So,
but,
Yeah,
I
that
know that
that that
there are.
that would be a day. But in they do serve a really great role, and some people, they do get better when seeing a chiropractor. The one thing that I always kind of educate patients is like, if you have to keep going back for the same treatment, like year after year, twice a week or once a week, like something's not working here, right? Like, we're not
yeah.
fixing the problem, because if you have to keep going back, for continuous treatments once or twice a week for years and years, and you're only getting a day or, a day and a half or maybe 2 days of relief in between treatments, then something is off there. And that's what I hear a lot from patients who do go and see chiropractors, is that, yeah, like I felt great, like when they cracked my back or, did an adjustment, but then the pain came back, like, 24 hours later. And then I always ask, like, what else are you doing, after you see the chiropractor? And there's nothing. Whereas physical therapists are going to give you home exercises. We're going to try to modify your activities. And that's also a big difference.
Let's switch gears and focus deeper just on physical therapy and when would you refer someone to physical therapy? In your mind, what is an ideal patient? When a patient sees a doctor or anyone is just kind of hurting, should they be seeing a physical therapist? Is there a reason you shouldn't see someone that's a physical therapist?
Yeah, great question. I think that this can be answered two ways. I think that almost anyone can benefit from seeing a physical therapist. You take those, like I talked about earlier, for prehab. Let's say you start a new activity, running or weightlifting, or a sport, and you want someone to kind of look at your form and look how you're doing it to prevent injury or improve your performance. That's one route of why someone might see a physical therapist. But more traditionally, if you take someone that's in pain, for example, back, who and who should not see a physical therapist. I think if we can get them early, it's always better. At the initial kind of onset of symptoms, I think a lot of people, tend to, wait and see if it gets better. And then they go to see the doctor. The doctor sends them for x-rays. The x-rays come back negative. Then they send them for an MRI, and the MRI comes back with whatever. And then finally they're going to see physical therapy. But at that point, they're already in a lot more pain.
Yeah.
So I think, if you could get them to us early, there definitely is significance there. And when it comes to who should not see a physical therapist, I think that's tough, because I really think everyone could benefit from seeing a physical therapist. Doesn't mean that they're going to get better, right? We're not magicians. Like, we can't help, everyone, although that would be nice. I think the toughest patients that don't do well with physical therapy are the ones that right away say physical therapy won't work. Like, those are the ones you should really consider, should I send this patient to physical therapy or not? Because their mindset is already in the wrong place, right? If they're not a believer to begin with, then those are really tough patients to treat, and they probably won't do well, with physical therapy. So kind of to summarize it, I think, everyone can benefit from physical therapy, especially at the onset of pain, and those that are looking to try to prevent injury, would also be great to, see a physical therapist.
Yeah, I think that the one thing that I agree with you, I mean, is that everyone, one, can benefit, but two, what I think a lot of patients don't realize is that physical therapy is not something that is a, you go to 2 or 3 sessions and then you should expect to necessarily have the result that you're looking for. Whereas maybe when we discussed earlier, sometimes you go to the chiropractor, you might feel better for a couple of days and you walk out of there feeling much better. But that instant gratification, I think, is what sometimes people are expecting, and that's really not the case, right? So I always tell people that it's a full program, but the program doesn't end there, right? There's the home exercise program, which we can maybe talk about briefly too, which is a really important part of the whole physical therapy program. So I do think that that's kind of where it gets a little bit more education related when it comes to talking to our patients and telling them that really the physical therapy, it's not just the 6 to 8 weeks, it's what you do after that really matters.
What do
Yeah,
you
totally. I
expect?
mean, yeah.
I was gonna say, when you get
What
these
do
patients in the beginning, what do you expect a patient to feel in the beginning? How do you know it's working? Because I get a lot of patients that say they do physical therapy and they say it hurts more. Is that normal? Is that abnormal? Is that a patient that's not going to do well?
I think I think it starts first off, on that initial visit, setting expectations, right? Like I always tell patients, if they come in and they have, moderate arthritis, in their hip or their back or their knee, there has to be some level of understanding here, right? Like we're not going to make that arthritis go away. Like we're not going to make you completely pain free, right? We can't
You'd make a lot of
cure
money if you made that
arthritis.
arthritis go away.
Yeah, seriously, I don't know
You'd
if
be
I would be
rich.
here on this podcast. No, uh, but but
Orthopedic
I
surgery.
think there you go. I think the expectation has to start, when a patient comes in for the first time, it's that initial conversation of, what are their goals? What do you expect? And then as a physical therapist, it's our job to kind of put those goals into what's realistic and what's not. So that's always an important thing, for patients to understand, because otherwise they're going to come in with false expectations. And I do tell them, listen, I'm pretty honest. I always tell my patients, there's a good chance that this might not work for you. Like you might not get any sort of significant relief, or you might not get to where you want to get to after physical therapy. But the bottom line is, at least if we're trying to build some strength or improve some function, then to me that's a win, right? So that's what I think is important too. And then you asked about like patients come back and tell you that they're in more pain, right? Is that what you said?
Yeah, yeah. It's a common thing that I
It
hear a
Yeah,
lot.
happens. Yeah, we get calls all the
that
I
time.
have
that
to
happens a
convince them
lot.
to go
So
back.
right, so it could be a couple of things. It could
What
be a
what do
bad
you
physical
what do you
therapist. Yeah.
I was gonna say, what do you attribute that to? Why would so here's my rationalization. I don't know if it's right.
Yeah.
My rationalization is like, imagine like you're going to the gym, and the goal is to break down muscle to build it up stronger. If you imagine someone that's completely deconditioned, they're at an exponentially greater amount of kind of risk to developing kind of more pain because they're not conditioned to the activity. And so in my rationale is I tell them, hey, that's normal. That means that you're actually pushing yourself to a point, and the physical therapist is there to help push you safely to that next point.
So yes and no, right? So again, I said, physical therapy, not everyone is created equal. Not all physical therapists are created equal. Not all of
Yeah.
them might not be as knowledgeable about a certain thing or know how to tolerate a specific patient. And that could be the problem, right? They could be too aggressive or doing too many things at once that, is exacerbating the patient's problem. So that definitely is possible. What people don't realize oftentimes is physical therapy, or at least good physical therapy, should not be coming in and getting a hot pack and e-stim and riding a bike, right? Um, Unfortunately, that's a lot of what physical therapy is these days. And that's not going to get you better. And those patients aren't going to be coming to you and saying they're making me in more pain, but they are going to be coming to you and say, I'm not getting better.
Or
So
Why
it's
is it
when
that
it
temporary
way
comes,
though?
relief.
Tell me why it is that way. Why is it that,
what
that is it just the way that the system is currently set up that, I have so many patients that'll sometimes come back and say, I got put on the bike, they walked away, I kind of got a little bit of massage, a little bit of stim, some ice, and then they sent me on my way.
Yeah, I mean, I think a big part of it is just insurance reimbursement. Insurance reimbursement in general for physical therapy isn't where it should be. So in order for these clinics to see, in order for clinics to generate a good revenue, they have to see a certain amount of patients at once, and sometimes that involves the patients doing things that they can kind of just do on their own that take up time, like a heating pad or a stim or a bike, and you might get 10 to 15 minutes with a physical therapist, and then the rest of your time is either exercising on your own or just leaving after that. So, for those patients that are, wanting to know about physical therapy and what good physical therapy is, that's not it, right? Like if you're going into a place and you're spending most of your session getting a heating pad and electrical stimulation and maybe 5, 8 minutes with a physical therapist, then, we're not doing our job. So definitely be on the lookout, for those types of places. And what else? You asked me something about about patients being in pain, and how do you know sometimes if it's the physical therapy or if it's the patient? So I said earlier that it could just be bad PT and them not doing what they should be doing or not doing it correctly. But a lot of times patients don't realize that this physical therapy is physical work. It does involve exercise and strengthening, which, like you said, can feel like muscle soreness. But if they're complaining of like sharp pain and pain that lingers for more than 24 hours, then something is not right, right? If they have a little bit of discomfort after their session and it kind of dissipates over time, then that's normal because we're moving things. If you have a little bit of an arthritis in your knee and you kind of do certain exercises, you might exacerbate it a little bit and feel some of that, increased inflammation for the next day or so. But that should subside. If patients are coming back to you and they're saying, hey, like I went to physical therapy and, I'm in so much more pain, the pain's been here for 3 or 4 days now, then something, is wrong there. And a lot of times what I see, in students or new grads is that, physical therapists, want to try to stretch and mobilize and do all these types of techniques that they just learned out of school. And if you take an arthritic hip, for example, that doesn't have, as much mobility as a normal hip, and you try to push it into that range where it can't go anymore, guess what? You're going to exacerbate the joint and that patient's going to have a lot of pain. So, I think it's important that you ask your patients what they were doing in physical therapy and how long the pain lasted.
That's that's helpful. So Brian, let me ask you a question because I think this is another topic of debate, but um, I'm sure you guys get a bunch of different types of prescriptions, right? You probably get
Yeah.
prescriptions that just say evaluate and treat, and then you probably get these detailed prescriptions of what they should and they shouldn't do, what precautions to follow. And I feel like, um, again, remember you're talking to two physiatrists here, so part of our training was kind of writing exercise prescriptions and things like that to send to a physical therapist with precautions, which I do feel like a lot of times, when the patients do come back in a lot of pain, it's with a lot of the exercises that we are kind of recommending against. And so I guess my question is, you know, what is something that you guys see often on the physical therapy prescriptions, or what would you like to see on physical therapy prescriptions to help guide you, or do you even care what you write?
So yeah, I mean, I think that this is a tough one. I think it really depends on your relationship that you have with the physical therapist that you're referring to. Because you can write down what you think and what exercises you want. You could send them to a physical therapy place and they're going to read that script like a manual. Like they're only going to do exactly what's on there and nothing else, right? And that could be an issue because you might be missing a lot of exercises, or the therapist might not be advancing them as they should because like the script says do this, this, and this, right? So I think it can go both ways, because if you have a good relationship with the physical therapist and you trust them and you know that they're going to do a good job with your patient, then I don't think that you should do too detailed of a script. I think you should just have the trust
Yeah.
in the therapist and let us do what we're trained in do and decide what exercises are appropriate and reach out to you, the physicians, if we have any questions. So I think it really depends on your relationship with the therapist, because it can both benefit you and hurt you as the physician, because they could come back to you, the one who sent them there, and now it's on you that they're not getting better. So
Let's take this through a patient perspective. Um, so let's do something very simple, like low back pain. And we've talked a lot about what a bad physical therapist is, which my understanding is the more passive it is, like if they're just putting hot packs on or a TENS unit or something like that. That's not exactly the best long-term goals. So let's have a patient low back pain. Maybe it's like he herniated a disc. Guy was squatting a lot or deadlifting and herniated a disc. Starting to get better. Coming to physical therapy. What are you going to do? What is kind of the mark of a good physical therapist? Take us through the beginning and how you bring them through that and how did they get
Right.
better?
So, I mean, first off, every patient presents differently. One that has a herniated disc is not the same as another one that has a herniated disc.
Yeah.
So it starts off with, having a conversation, like I said earlier, about expectations, what, is bothering them, what they can't do, how their pain is relieved or what makes it worse. Having a good kind of subjective conversation to, have the patient, build trust in you as a therapist right away is important. And then it goes into, doing a good evaluation, seeing which position makes the pain better or worse, what they can and can't tolerate, any strength deficits or range of motion deficits. And then from there, building a plan. And that plan should incorporate what they had mentioned to you about, what it is that they want to get back to. So after you do your subjective, talking to the patient, getting a good history, and then you do your evaluation, then it's kind of setting up a plan. And so usually that should start with, a couple of exercises. Traditionally herniated discs, do better more with an extension bias, which means, they have more relief in standing and being upright than they do bending forward, because as you bend forward, it puts more pressure onto the nerve, which oftentimes reproduces their pain. So teaching them about education, try to avoid sitting for long periods of time, try to be careful when you're bending down to pick something up that you keep your back straight. So good patient education, and then, going into exercises, and that can be many different things depending on how the patient presents.
That interesting concept, just to go back, is the extension-based movements is the Mackenzian protocol. Did I get that right?
Correct.
Yeah, and I think, I mean, if anything, it's like educating people about the fact that when you have a physical therapist that understands that, maybe that is something that you look for as a patient. You're saying, "Oh, I have this, and something that's focused in this realm is probably what I should be doing."
Yeah, I think it's pretty traditional that a lot of people are familiar with the McKenzie approach. I mean, I've worked with I don't even know how many people have had a herniated disc, and some, tolerate the McKenzie approach, and some don't. Again, I think it just depends on the patient,
Interesting.
but traditionally, that is how they feel better is more an extension bias. So that's an important thing to kind of talk about right away.
What do you tell them as they're going through physical therapy? Do you tell them that, like, the goal is to get you through this, but you're doing these exercises after? Is that commonplace for every physical therapist to kind of create a regimen as they're going through it?
So, like, explain a little bit more. Like, so you mean like during the session, or you
Uh,
mean like continuing to home,
yeah,
or uh
Yeah, like
huh?
continuing to home, like is that in like the 6 to 8 week period of going through this, are you generating a regimen for them as you're going through it and saying, "Hey, this exercise is something you should be working on. This is something you could do. This exercise seems to make you feel better." Are you generating that in your mind as you're going through it, or is it something simple that like every single person has just print out and it's like, "Here you go, done."
Well, I think it's definitely trial and error, because I think, again, some people respond well to some things and not others. So, one of the most
Yeah,
important things about your session with the PP is figuring out what works for you and what does not work for you. So that way, when they go home and you create a home exercise program for them, they're doing the exercises that they know were not as painful with you in the clinic supervised, so that they could try to mimic that at home. So I think that a good
yeah.
portion of your session should be doing exercises together to make sure that you can tolerate them and you're doing them correctly. And then, of course, a home exercise program is essential. If you're not compliant with your home exercise program, like I always tell people, there's a good chance that this is not going to work. And if it does, it could take twice as long, because I might see you once a week or twice a week, and that's not enough. So definitely, what you do in the clinic, should have some sort of home exercise program affiliated with it.
And how much is enough? If you're saying, 1 or 2 days a week is not enough, what should we be educating our patients, um, you know, that how often they should be doing these? And
I mean, in a perfect world, everyone should be doing some sort of home exercise program every day. I mean, you take someone that
Yeah.
has a herniated disc, and, part of their home exercise program might just be tolerating a little bit of flexion for 5, 8 minutes a day, or working on some gentle core exercises. Like, we're not giving anyone a home exercise program that's like serious weight training where your body needs time to recover. In a perfect world, people should be doing their home exercise program daily. But, as you both know, life gets busy, and not everyone wants to come home and first thing they do is spend 15 minutes, doing their, physical therapy exercises. So,
yeah, yeah.
that's just kind of how it works. But listen, if they
That's
do it
what
once or twice a week, then that's what we can do.
it's like I tell John he needs to work out in the morning. It's like it's so hard to go to work and then come back and be like, "Oh, by the way, I'm gonna go work out for the next like 2 hours of my life." You're so tired, and I like that. I mean, like I like some to some degree having the mentality of it's daily. I even tell my patients, I'm like, "Hey, first thing in the morning, you wake up, you start stretching." Like it's so easy because it's like you have like your mind can't think to give you an excuse at that point.
For sure.
Yeah, but
And
you're not
that brings up
married, you don't have a kid, you don't have any of that stuff. So, like, let's before you start throwing me under the bus
All
about
everyone
right,
going
both
to
of you
finds
work out in
guys.
the morning.
everyone finds excuses.
Both of you have
Married,
kids. All right.
kids,
You don't
no
need to
kids.
kid shame me.
Everyone finds an excuse. But I want to bring up, Neal. A lot of people, have been asking me recently. You say like, you're busy. The last thing you want to do is go to a physical therapy place. Like it's just a hassle. You want to get home.
Yeah.
Physical therapy is taking, uh, a virtual turn, where a lot of physical therapists are, doing virtual PT sessions. And, patients, like that. It's not for everyone, but, they can go and do it in the comfort of their own home. They don't have to go somewhere. It is reimbursable by insurance. I believe, even Medicare is paying the same reimbursement rates for virtual PT as they are in person. But again, it's not for everyone, but it certainly is for some people. So just want to throw that out there in case, people just say, I don't have time to go. I don't want to, take the subway
Yeah.
or drive to a place. There is that option as well.
And we
I
talked
do
about the
all
back already. Sorry, go ahead. Go
I
ahead.
was gonna
Sorry,
say I do
Neil.
always tell my patients, and they're like, "Oh, should I come to this fancy facility that's like 2 hours away?" I'm like, "No, no, no. Go to the one that's like right next door to your house. It's not that crazy what's going on as long as they're active, like you're saying. The mark of a good physical therapist. It doesn't matter where you're going. It needs to be something consistent. And I think that that's what you're kind of saying. The consistency is key. And if anything, it's you not only doing it with the physical therapist, but you doing it by yourself.
Right. Totally.
What were you
Totally. It
about to
doesn't
say,
matter if
John?
you have the best physical therapist in the world. If you don't do it yourself, then guess what? You're not going to reap the full benefits.
Yeah. So, other than back, is there other things that what other joints can you work on? What other body parts, or what can't you really kind of rehab, if anything?
So physical therapists only treat backs. That's it. We don't treat anything else. No.
Well, that's what you made
Uh,
it sound like. That's what you made it sound like chiropractors do. So,
Yeah.
I'm just
so
trying to see what
I'm
else you
probably gonna
guys
get
do.
yelled at by a lot of chiropractors, but that's why you should bring them on the show so they could talk about what they do. So no, we treat
And they're gonna say physical
physical
therapists
therapists
only do
treat.
back.
Right, exactly. They don't do anything else. So physical therapists, I mean, we kind of treat almost everything, musculoskeletal related, as, shoulders, neck, mid back, low back, hips, knees, elbows, hands, ankles, foot. I mean, we kind of treat it all. And then, there's specialists that work with patients that have spinal cord injuries or traumatic brain injuries and Parkinson's and, all sorts of, other types of conditions that aren't your traditional orthopedic issues like, shoulder pain or back pain. So we really do treat, almost the entire body when it comes to, the musculoskeletal system.
That's interesting. I mean, I obviously we know like all the various things, but I think the interesting thing you touched on is the specialties, because there's also pelvic floor therapy, which is oftentimes a black box to me, even having referred to a lot of them, um, and it seems like it's one of those things that a lot of people have some of these issues. And when do you refer to some of these specialists? How do you know that something requires a specialist in physical therapy?
Well, let's talk about the pelvic health. That has really, expanded quite significantly in the last couple of years, where, urologists and, other medical professionals are really, seeing the benefits of sending their patients to, a pelvic PT. I am not a pelvic PT. I haven't been trained in any pelvic PT, so I can't speak too much about it, but a lot of women and men have significantly benefited, from it. And, for example, sometimes retraining the muscles in the pelvic floor can help urinary incontinence and, other types of issues. So it definitely has a role, but the patient has to be, the right fit for pelvic PT. In regards to other specialists within, the APTA, I might not hit them all, but there's, orthopedic clinical specialists, there's sports clinical specialists, there's, neurology specialists, there's geriatric specialists, there's pediatric specialists. Um, so, all physical therapists can pretty much more or less treat everything. Some people might find, as in a patient, might feel more comfortable just with the mental knowledge that this physical therapist has additional training. But,
Yeah.
you know, physical therapists are trained, to more or less kind of diagnose or scratch the surface of all the things that we're trained to do.
Great. I mean, that's all super helpful information for me. Learning a lot of stuff today too. So thanks, Ryan. But I guess we talked a little bit about things that you didn't want to see a therapist just throwing you on the bike, giving you some tens unit, some ice, and kind of sending you on your way. But modalities is a part of physical therapy as well. So do modalities work? And what are some of the modalities that work? I know that there's things like the tens. Patients always talk about dry needling. They talk about traction, those kind of things, and of course heat and ice. But what kind of things do you often use, or do you see people use that are actually beneficial?
So, this is a highly, debated area. You can read so many research articles and they will tell you the pros and cons of a lot of the modalities that we use in physical therapy. Some are very supportive, some are not so supportive. I think, it just depends on what your goal is. So, for example, heat. Heat helps bring blood flow to the area. It helps kind of relax muscles. It's better used for chronic conditions without any swelling in the area. So, if a patient might feel better when they do heat before they exercise or after they exercise, then it's fine. Same thing with cold, but cold is better used for acute injuries and if there's swelling in the area. But in general, I mean, if the modality makes them feel better and it's not causing any harm and it's used in the right way, then it's fine. You mentioned e-stim, electrical stimulation, which basically is a way to kind of help. Well, there's different ways to use e-stim. The traditional way is for pain, And again, after your physical therapy session, if, putting on a stim machine and ice, makes you feel a lot better and help keep some of that, increased discomfort that might have happened during the session down for a while, then it can be great. Or if the patient wants to use a TENS unit machine at home a couple times a day because they have pain, then that's also great. But the biggest problem with modalities is that they're oftentimes overused or they're used too much in and of themselves, meaning that there's not other, therapy to kind of go along with it, right? It might just be, heat or stim, or when I have back pain, I just throw a hot pack on and put the stim on, but I'm not doing any exercises at home. So I think when it comes to modalities, again, there's a right place for everything. And as long as it's not doing any harm and the patient feels better, then it's okay. So that's kind of my, 2 cents on it. But I think it's kind of a good takeaway that as long as you're doing it correctly and you're using other things and not relying on it, then it's okay.
When you say doing harm, how do we know if it's doing harm? What actually does harm? Is there anything, um,
Well, I
can you give me a
mean,
little bit
you
more?
take like the basics, like, using a heating pad and, leaving it on for, too long and it could burn you, or, if you have sensitive skin and, you use a cold pack and, you don't put, something down on your skin to use as a barrier, those what I mean, like do no harm. Like if it's not hurting the patient in
Yeah.
any way, then it's okay,
Okay.
and I do recommend that, everyone that does use like a home TENS unit machine, if they're going to physical therapy, have the physical therapist train them on how to use it and where to put the pads. Because if the pads aren't placed correctly, then you're not going to get the benefit of the TENS unit machine. So, if anything, if patients aren't seeing a physical therapist, try to, dive into some, Google and, of course, credible sources on how to use a TENS unit machine so you get the best benefit from it.
Now, not to beat a dead horse here, sorry to keep kind of going at this, but traction is a thing too that my patients swear by. So, can you tell me just a little bit, just very briefly, kind of, I really want to know because I really do want to educate patients about this, and I don't know when traction is appropriate or isn't appropriate, whether it's neck pain, back pain, or anything else, really.
So, first of all, traction, I'm not the biggest fan of. That's me personally. It does work, for some patients, and and that might be okay for them. But here's the thing with traction: it definitely should never be used in the acute phase of any disc issue. And the reason why is because there's a lot of inflammation, irritation around that disc, right? So traction is an input where it's pulling, right? So think of, someone pulling your legs and then someone pulling your arms at either end, right? You're trying to create space, okay? So if that's done too acutely, right, the nerve might react to that and it could actually cause increased pain and discomfort initially. So traction should never be done like right when someone has an acute disc issue, first of all. When you're looking at traction in the chronic phase, it especially the lumbar back where it's such, there's such big segments and it creates so much, there's so much force that needs to separate things. The patient might feel better with that gentle kind of release of things. But then guess what? Like right when you stand back up and with time, everything goes back together, right? Like it doesn't like traction doesn't keep things separated because if that was the case, everyone would be way taller and I would be doing traction every day. Um, but
Me too.
people
Me too.
people feel better because of two things. One could be a placebo effect, right? Like you talk traction up, you let them know that what it's going to do and how it's going to work, and then they do it and they feel better. And the other thing is that sometimes when there is a little bit of release in a certain area, let's say the back, the lower back is, arthritic or, you're dealing with some sort of, chronic disc problem, sure, maybe a little bit of separation can help reset that pain cycle, temporarily. And then the patient might get relief, for a couple hours or a day. But I think in general, it takes a lot of time, and if that's what is eating up the session, then I don't. I think there's better alternatives to traction in physical therapy. But it does have a role, and people do get better. So I don't want to say no one gets better from traction. It's just not always my first line, to go to.
Makes sense. Um, all right. So we've been at this for a little while now. I think we've learned a decent amount about what physical therapy is. I mean, I know I got a pretty good lesson on a lot of your expertise, which is very very useful. Is there anything that you got like last minute things on what you think is important people should know about physical therapy? Is there anything you didn't cover that you think would be helpful to know?
I think that everyone that doesn't want to either go through any sort of surgery initially, or is having some discomfort that is bothering them enough that it's affecting their life, to definitely try physical therapy. I think that there is a role of what we do as a physical therapist, that we try to improve people's function, and we try to get them as pain free as possible. Obviously, working with you guys and the appropriate medicine. But I just want to tell everyone that hasn't tried physical therapy, that might be either afraid or they've heard bad things from their friends, give it a shot, try it again, and hopefully, you learn some things, of what to look for, in a physical therapist and a physical therapy practice, that might get you better treatment, and give it a shot.
I like it. I like it simple, functionality, and essentially quality of life. Thank you so much, Ryan, for coming on today.
Yeah.
Thanks for having me, though. This
Yeah,
was
All
thanks
great.
for
right.
taking the time. I appreciate it, and we'll look forward to talking to you again.